I've seen so many people suffering from leg pain and back pain related to lumbar spinal stenosis. And what I've learned over the past 10 years is that we need a well-rounded approach, not only to reduce pain, but improve strength and ultimately improve resiliency along the way. We need to make sure that we are safe and we're being very targeted in what we're doing. And so that's exactly what I'm gonna go over today. We're gonna go over the exact program that I use to help people avoid surgery and unnecessary medications and potentially fix their lumbar spinal stenosis pain. So the Spark program is that well-rounded program. We're not only gonna be talking about specific exercises and how they need to be done, we're gonna be talking about other aspects such as traction. Where does that fall? What about TENS units? Those are the questions that my patients ask me, and what I tell them is a blend of the research and what I've seen work with actual patients that I've seen go through this program. So this program is going to cover very detailed aspects. I do recommend that you do complete some aspects of the program every single day if you want to take yourself from where you are today and improving resiliency. But the good news is I'm going to be covering the exact caveats and the exact aspects that I discuss with my patients to make sure that they have the long-term results that they were looking for. So before we waste any more time, let's start reviewing that Spark program and go through the exact thing that I would tell my patient who is sitting right in front of me. So with the Spark program and over time, we use targeted exercise, mobility exercises focused at improving the health of the spine and the nerves so we can make sure that you are improving and moving towards resiliency and giving yourself the best shot possible to avoid unnecessary images and unnecessary surgical interventions. So let's talk about the Spark program. The Spark program is a lumbar spinal stenosis program that I've developed after years of treating patients and looking at the literature. Aspects of the program include strengthening, pain relief, activating the nerves, regaining mobility, and then keeping mobility and walking and movement at the center of the program. And so when we combine those things, we have really, really good results. And so I'm going to go over with you the exact aspects and what I would do in each one of those phases. I'm also going to be demonstrating the exercises related to the mobility and the nerve health and the strengthening. And so you have a clear idea of what you should be doing at each phase. So remember, the goal of the Spark program is to reduce your pain, improve your mobility, give you less discomfort, and so you can do more in your day and move yourself towards resiliency. And so it's a no-brainer to think that strengthening is a part of that program. And so when we really look at strengthening when it comes to lumbar spinal stenosis, there are some non-negotiables. Those non-negotiables are you need to be doing strengthening at least 2 to 3 days a week. You need to be doing it in a way that's relatively pain-free and that you can be successful. You need to be consistent, so 3 to 4 weeks of consistent effort exercise to not only improve your muscle size and strength, but give you some of that pain relief as well. And so when you combine those things, you're going to achieve the results that you're looking for. And so I'm going to be going over in just a second what those exercises are, and so you know exactly what to do and exactly what they should feel like. But just remember, you need to stay consistent with this program to achieve the results that you're looking for. Okay, so if there were 2 exercises to rule them all when it comes to lumbar spinal stenosis, these 2 would be it. I'm going to be using a suspension trainer, and so you can look this up online, or it's also maybe called a TRX, but it attaches to your door. You can anchor it anywhere. What it's going to allow us to do is get through the lumbar flexion range of motion without having to worry about our balance. And so we're going to be using the suspension trainer, adjust the handles as need to. You're going to be going into a squat position, so lean back, trust the suspension trainer for a second, and you're going to squat and come back up. Squat and come back up. Remember, we are doing this 2 to 3 times a week, so every other day we're going to be doing 10 to 15 squats. It should be relatively pain-free, but what this is allowing us to do is get into that lumbar flexion range of motion right here and starting to build strength in our legs. And so the strengthening aspect of the Spark program is really important, but it doesn't have to be complex. We'll use the suspension trainer to get down into that range of motion. We're going to do 15 squats here, and we're going to be doing 2 sets of those. So you don't have to go down all the way. You don't have to go down crazy far at first. Use your arms to help you out. You're going to be keeping a little bit of bend in your arms. You're going to be going down into that squat and enjoying that squat. 12 to 15 reps, about a 1 to 2 to second hold down there. You don't have to get fancy, you just have to do it, okay? So now this is allowing us to start and build some leg strength and improve flexion of the lumbar spine. Now we're gonna be working into the second exercise, which is the lunge. And so you'll be doing this with the suspension trainer as well, and you will do it all on one side before you move to the next. So big step back, tall body. If you need to lean forward a little bit because your back's bothering you a little bit, that's okay. So flex if you need to. Remember, flexion is our friend. So flex and then bend. Flex and bend. See how far I'm going down? I'm not trying to go down all the way. What I'm doing is I'm trying to improve my stride length. This is what's sneaky about it. Is when I work with my patients, they think, oh, you're trying to improve my leg strength. I'm like, well, yeah, but I'm also trying to improve your gait, right? Getting one leg behind you helps you walk longer and taller. And when I work with my patients with spinal stenosis, they're like, I want my posture to be better. So this hits everything. So you're gonna be doing 10 reps on each side. I think I'm at about 5. And guess what we're gonna do? We're gonna hit the other side too. So 10 reps, very good. Now come forward, big step back, tall body, 10 more lunges. Strengthening, man, it is not only good for lumbar spinal stenosis, but I can't think of a single condition from heart disease to anything else that doesn't benefit from strengthening. Now it is harder, so that's why we can only do it every other day, and we need to give your body some rest. But what you will notice is that over time, starting off with that 10 reps on each side, you'll be able to do 12 to 15 and stick with it for 4 to 6 to 8 weeks to notice that improvement in strength. And if you have any pain while you do it, refer to the pain relief stretches so you can give yourself some relief and then get back to the strengthening. Don't avoid it, just learn your body and learn how you can do it safely and with less discomfort. So use the squats with the suspension trainer, use the lunges with the suspension trainer to help you achieve that strength in your legs and improve your ability to walk and stand while reducing your back pain and leg pain at the same time. So the second phase of the Spark program after strengthening is pain relief. And so unlike strengthening, pain relief modalities and things that you do to achieve relief can be done every day. So remember, strengthening is about every other day. These pain relief strategies, I recommend doing them as much as you need to. So let's review some of the most common pain relief strategies that I use with patients with back pain and leg pain related to lumbar spinal stenosis. One being a traction machine or a traction unit. And so these units can be found at a chiropractor's office or other offices that have the unit. You can buy units online that kind of give you that separation as well. And so what I have found with my patients and after reviewing the literature related to my book that I just wrote related to spinal stenosis is that traction units can vary and the exact way that you do it varies as well. And so let me give you an example. Some places may recommend that you do it for 5 minutes, but 5 days a week, and other places may recommend 2 or 3 days a week before 15 minutes. And what the research showed is that when you're actually doing traction to the spine and you're trying to pull on both sides to increase the space, because that's what we want to do with stenosis. Stenosis is a space issue, so we want to improve the space. So intuitively, it makes sense that traction would work. But when we're looking at how much space is actually improved when you do traction, it's millimeters, 2 to 3 millimeters, which makes a big difference. I mean, you could only have, a few millimeters left in your spine in a stenosis, so it can make an absolutely big difference. What I have a problem with is that doing lumbar spinal stenosis treatment, and some of that including traction, and doing it, let's say, every other day, and giving yourself some relief, but you're not taking advantage of that pain relief. And so what I recommend to my patients is try it out and see if it works for you. But if you do complete the traction and improving the space in the spine, the research shows that you need to be doing some exercises after it. So if you do the traction and you're looking at the Spark program, I would be doing the pain relief traction, and then I would be doing the mobility and strengthening. And so you would be doing the strengthening aspect and then regaining spine mobility. When you combine those things, the results are just better and the results last longer. The other aspect is TENS. And so a pain relief strategy that I see patients use and they ask me about is a TENS unit. And so what that TENS unit is just an electrodes to the lower back or in the leg or wherever you're feeling the pain. In fact, I actually did a video of this recently when I go over the exact placement of the electrodes and the settings and stuff. But when you're looking at a TENS unit, it can reduce pain. It can reduce the sensation that you're experiencing from your spinal stenosis. And so what it will do is reduce discomfort, but it has no impact on the actual actual space of your back or the actual nerve health. It just gives you some pain relief, and that's why you can use it often. So if you have any questions regarding the TENS unit, just refer to that past video I was talking about. It'll shed some light, and I also have a very detailed section of this in my book. Another more recent treatment for lumbar spinal stenosis and related leg pain is dry needling. And so what dry needling is an acupuncture needle going into the muscles of the lower back or leg to help reduce the discomfort and improve the pain related to muscle spasms. And so dry needling goes into the muscles, so it primarily affects the muscles, but it also induces like a local pain relief response that you would get similar to a TENS unit. And I like doing dry needling because it's kind of the best of both worlds. You get the work of the muscle, and you get the tingling response, and you get the pain relief after. But just like traction and TENS unit, dry needling should be used with other treatments. And so dry needling is something that can be done by physical therapists and chiropractors and other people. You can look up your local providers, but the dry needling session is relatively painless. It feels pretty good, especially into the lower back and glutes, and so it may be a part of your program, or it may be a part of pain relief strategies that you use. Now, the last pain relief strategy that I think is the most impactful is just stretching. Remember, lumbar spinal stenosis is a space issue of the lumbar spine. And so when we zoom into the lumbar spine and the space around the nerves, it starts to get less. It starts to experience arthritis and degeneration that causes the nerves to become irritated. And so the classic sign related to the lumbar spinal stenosis is that you sit and you have immediate pain relief. You don't know why. You've got back pain when you stand and walk, but when you sit, you feel really good. You feel really, really good. And so we use that strategy to give you some pain relief, and we use stretching. And I'll review those stretches here in just a second. But what they are is just a flexion-based exercises and stretches to help open up the space in the back. And what I like about stretching to reduce pain is that you can immediately stretch and then start strengthening afterwards. It's very, very cheap. It costs you no money. You could do it anytime in your home, and so you don't have to rely on somebody else to do it to you. And it can give you that a little bit more lasting relief. And so what I tell my patients is that the first pain relief strategy that we always start with and that I incorporate in the program is stretching. And I'll review more mobility exercises here in just a second. But when we use flexion-based exercises and kind of curl that spine, it will give you some relief, and you'll stretch your back at the same time. And before I waste any more time, let's go over my favorite stretches for lumbar spinal stenosis for pain relief. So this is probably one of the most consistent and easiest ways that you can have pain relief while using a stretch to help you do so. And so when I talked about pain relief strategies, we talked about things that kind of require you to go somewhere or somebody to do something to you or some sort of equipment, where this requires nothing and you can do it as much as you want. And so this is called a seated lumbar flexion. And remember, flexion is our friend. It opens up the spine. And so when we spread our feet and we kind of bend forward, it gives us pain relief. It takes away our leg pain and whatever. But the thing is, with the Spark program, we incorporate this flexion-based exercise whenever we need it. And so if you're doing your strengthening exercises and you're having your pain, you can go ahead and do seated lumbar flexion. If you're at home doing the dishes and you're feeling pain and pain down your leg, go ahead and do the seated lumbar flexion. You can't overdo it. So spread those feet, round out the upper and lower back, go down and touch for 2 to 3 seconds, and come back up. Don't arch up. Whoop, that could cause you discomfort. Just go down, whoop, and come back up, and go down and come back up. You would not believe how many people have been so surprised they could do this as much as they want. And I kind of give them the okay to do so, and they're like, wow, I had no idea I could do that so often. It's not going to hurt me, and it's going to help improve my pain. Before we can really start strengthening and improving mobility, we need to reduce discomfort. And so this is the way that we can reduce discomfort. You can do it virtually anywhere. I tell people to kind of do 8 to 12 reps with about a 2 to 3 second hold, and just reduce that pain along the way. Now, if you have your feet closer together and bend down, that's okay, or like it really far apart, that's okay too. And to level it up, let's say you're having more right side leg pain than left, well then kind of lean towards the left, right? Lean away from it, open up that side more. So feel free to try different sides. You can try varying hold lengths. You could do 1 second or 3 to 5 seconds. But typically I have my patients looking for that pain relief. Go ahead and do about 3 to 5 to 8 to 12 reps. And that usually takes them out of their pain and their pain down the leg with that 2 to 3 second hold. So this pain relief strategy can be done so often, and use it whenever you need to reduce your back pain and leg pain. So the third phase of the Spark program is activating the nerve every single day. People, when they have lumbar spinal stenosis, they can typically live with a little bit of back pain, but what they can't live with is the leg pain. It's the pain that's causing from the pinching of the nerve in the lower back that's causing pain down the leg. That gets debilitating, and that is awful. And that pain is typically associated with standing, arching your back, or walking that will cause pain down the leg. You can also have a sign that's called neurogenic claudication, which means that as you walk, the pain in your glute or in your leg builds up until you sit down and rest, in which it can almost immediately go away. The shopping cart sign related to spinal stenosis is that you use the shopping cart to give you relief when you're doing your grocery shopping, because you can do it, it's no problem. But when you try to grocery shop or walk without that cart, things get a little sticky. And so a foundational part of the Spark program is activating the nerve to help improve its resiliency so you can walk longer without leg pain or nerve pain. And I know it sounds weird to activate the nerve and kind of stretch it in a way that improves its tolerance, but trust me, it works. And it's called adverse neural dynamics, and we will improve that, and I'll show you the exact exercises that I use with someone with stenosis to improve nerve mobility and nerve health. This is a game changer. You're going to want to pay attention to this. You're going to want to do these every day. Let's go over that right now. Okay, so when we're talking about activating the nerve and improving the tolerance of the nerve, that's exactly what we're going to do with this strap. And so you can use whatever you want, a towel, a belt. It just can't be stretchy. And it's nice if it has a loop at the end of it so you can put your foot in it. So take the strap, put it around the foot that you're having the issues, or the leg that you're having the issues, whether that be more glute pain or pain down the leg, and go ahead and put it around your foot and lay down. So what you're gonna do in this position is you're gonna straighten the leg that isn't painful. You're gonna straighten both legs. You're going to put it around the end of your foot, and then you're going to pull up while relaxing your head. You're going to pull up until you start experiencing symptoms. So for me, that is right here. And then once you feel tightness in your leg, whether that be the calf, the back of the knee, or down the leg, you're gonna pull over across your body until you really feel it start to burn or feel it start to pull. Now, some people don't want to hang out in this position, but remember, we're trying to improve the tolerance of the nerve. And when we're trying to reactivate the nerve, we're trying to improve its ability to fire and have less pain at the same time. So you're going to pull that leg over, you're going to hold this for 20 seconds. Ooh, now for me, when I do this, I feel it all the way down to my foot. I feel it starting from my glute, and I feel my foot start to tingle, and I'm just pulling back towards my face, keeping my arms nice and relaxed. And I'm gonna feel that for 20 seconds here. Oh, and come back down. Oh. So this is called activating the nerve. We want to activate it so it can heal and regain tolerance to movement. Again, so pull up till you feel tension, pull over till it gets pretty intense. You're gonna hold that for 20 seconds. Oh. Now, if you wanna do the other side, you can. If you wanna put yourself through that torture, that's totally fine. There actually is some research to show that both sides is good, but I would recommend that you do 5 sets for 20 seconds to help improve that nerve health and mobility and activate it. Now, what you will notice is that it will improve. You won't have as much pain, so go a little higher. Go a little bit more over until you feel it. Hold it for 20 seconds. Ooh, yeah. This is a nerve stretch. This is not a hamstring stretch. It will feel very, very different. We're trying to improve nerve health, so we're going to have a nerve pull during this. Ooh. And so that's why a phase of the program, of the Spark program, has to be activating the nerve. We want to make sure that we're improving the nerve health and mobility so you can walk longer and have less discomfort along the way. Okay, so now we've worked on strengthening, that should be done every other day. We've worked on pain relief strategies that can be done when you need to. We've worked on improving nerve health and activating the nerve, that should be done every day. And now we need to work on regaining mobility. So remember, with lumbar spinal stenosis, it's a space issue. And so over time, we notice that people tend to creep forward in their posture because they're trying to increase the space in their lower back, which intuitively makes a ton of sense. It absolutely works because as you lean forward, you have less pain, you're opening up the spine. But because of that, and because most of the time people have had pain for a while, their posture changes. They start to have permanent or semi-permanent changes in their back that have resulted in a reduction in mobility of their hips and their spine. And so I'm going to be going over with you ways to improve mobility after years of just having changes in that spine that not only will improve your symptoms, but will improve your posture. These mobility exercises will be done every day. Let's review them right now. So we just got done improving the nerve health and mobility through activating the nerve. Now we're going to be focusing on regaining mobility of the spine. Remember, stenosis is a flexion preference and an extension intolerance. We don't like to move into extension standing and walking because we're losing space. But because we've had that over time, we start to lose mobility in the back. And so we're going to be regaining some mobility. You're going to be getting on your hands and knees here and really focusing on doing the right thing at the right time and feeling the right thing when you should be feeling it. And so I'm going to be going over that caveat. But this is a quadruped position, and a lot of people have done cat camels before, but what's different now is I'm going to show you exactly the range of motion that you're looking for and how it should feel. So let's review for a second, and that this is flexion, this is what it looks like when you sit, and this is extension, this is what it looks like and feels like when you stand. 9 times out of 10, extension or poking your butt out or divoting your lower back here is going to cause you symptoms either in your back or down your leg. Now, when I work with my patients and we're just starting the Spark program, all we focus on is flexion. We go from neutral to flexion, neutral to flexion, and you really contract the abs and pull the pelvis underneath you and round out your back so you have zero pain and that you feel a back stretch. 9 times out of 10, you are very good at this movement of going neutral to flexion. So what I have my patients start with is reducing pain and improving mobility. So we're going to be going into flexion only from neutral. So remember, neutral here, flexion underneath, and we'll do about 15 reps of that. So flexion from a neutral position, 15 reps. You should not have any back pain. You should not have any nerve pain, no butt pain or leg pain allowed. Okay, so after we've done about 15 reps here with about a 1-second hold, we're going to start moving into a little bit of extension. This is the one that takes a little bit longer. So most people are very good with flexion in the very beginning. They're like, I can do this all day, Michael, et cetera, et cetera. This feels really good. All the stuff that I've heard before. So after we've done with the 15 reps, now we're going to be working into extension. So this is neutral spine. This is flexion, and now we're going to poke our butt out into extension. Now, when you start to poke your butt out, if you feel any leg pain or glute pain, avoid that range of motion for right now. So for me, I can go all the way and I don't feel any pain at all. I don't have lumbar spinal stenosis. But if you start to poke it out a little bit and start to feel pain down your leg, stop and then do your flexion. And then poke it out a little bit, stop, do your flexion. So if that's where you need to be for 1 to 2 weeks, that's okay. But over time, you will notice that you'll be able to poke your butt out more, get a little bit more extension, and really regain that range of motion. And so poke your butt out, extend, and then come back. Now, the biggest caveat here is back pain is okay, leg pain is not. So if you extend and you keep poking, but your back pain increases, but your leg pain does not, that's relatively okay as long as it completely goes away when you flex again. You have no lingering back pain. So let's say, for example, you poke out, you can feel it in your back, but you don't have any leg pain, and then you're going to flex and you feel pretty good. Then I would do 15 reps with about a 1-second hold there. Now let's say if you go to poke your butt out, and you feel back pain and leg pain, remember, don't go into the leg pain, reduce your range of motion, and then go back into the flexion to give yourself some relief. So you could do 15 reps there, but then just give your body some time. Everybody's time frame is different. I've seen people regain extension range of motion week 2, and I've seen people need 8 to 10 weeks to regain extension range of motion in a non-weight bearing position. Now in my book, I go through every phase, the 8-week program, but for this instance in that we're reviewing right now, just focus on a pain-free extension. You can have a little bit of pain in your back, but no pain down the leg. Do 15 reps or so for about a 1-second hold. That's what it takes to regain spine mobility when you have lumbar spinal stenosis. And if you took anything from that, it would be that it's a little bit more complex and nuancey than you would think. And so if you have any questions, make sure you ask them underneath the video. And so regaining spine mobility is really, really important, but what also is really important is how you do it and how you feel along the way. Okay, so now that we've improved strength, we've reduced pain, we've improved the nerve health, we've improved the spine mobility, the last part of the program is keep walking or keep moving. It is important with lumbar spinal stenosis, since the greatest impairment typically is associated with walking, that we improve walking. And unlike other conditions, stenosis is very interesting in that you treat it in a way that actually causes your discomfort a little bit, and then you lay off of it until it goes away, then you cause it again. And so 99 out of 100 of my patients with lumbar spinal stenosis are doing a walking program. So let me give you an example of that walking program. The walking program would be you start to walk, and whether that with a cane or a rollator or on the treadmill, you walk until you start to experience symptoms, whether in your back, your glutes, or your lower leg, then you stop. And so if you're on a treadmill, you'll do a little stretch, maybe a little lumbar flexion stretch. If you're walking outside, you'll have a seat or use your rollator and sit down. But then as soon as your symptoms go away, you walk again. And so the pattern is walk, pain, walk, pain, walk, pain. And then over days and weeks of doing that, you will notice that you will have less pain and you'll be able to walk further with better posture and having less back pain and leg pain along the way. So a walking program is an absolute necessity that should be done every day. Remember, we're going through a Spark program that is going to be 4 to 6 weeks in length on its own, if not longer. And so just keep with it. I know it doesn't make sense, and I know you don't want to cause yourself discomfort, but trust me, you're not doing any harm. But this walking program is going to improve you. It's going to help you walk longer with less discomfort. And so when we're looking at every aspect of the Spark program and finishing off with the walking program, all of those things are going to help you improve your resiliency and improve your ability to move and function while reducing your back pain and leg pain at the same time. And so when you incorporate the aspects of the program, they are going to absolutely help you. So the results that you're looking for can absolutely be achieved. We've reviewed the Spark program and every aspect of that program that can give you those long-term results that you're looking for and help you avoid scary things such as surgery injections. But what you need to remember is every aspect of that program needs to be done in some sort of capacity every day, and that it will take time and effort. And this is the hardest part of what I do, is that I need to show you that all that time and effort will be worth it. And the great thing is everything that I reviewed today is relatively low risk. And so please try the program. If you have any questions, let me know. I do have a book that I've worked on that is a very detailed program that goes through 8 weeks of the Spark program and then how to build resiliency when you're done with it. And so that may be something that you want to check out, but please ask any questions that you have in the comments. I will get back to you. I think it's important to have those answered. But as always, guys, stay healthy, keep moving, and take care of yourself.